A lot of questions coming in on healthcare, and one that caught our attention was from PJ, a blogger who wrote this. I work part-time so I can help raise my grandchildren and had to buy my own health coverage, which is expensive, $213 a month, when I only bring home under $700 a month. How will this new program help me? Well, PJ, first of all, thanks for writing in. As you might guess, so far there are a lot of details still to be worked out with what healthcare reform, this transformation, might ultimately look like. Having said that, we're starting to get a better idea of the specific numbers and, to your point, the specific costs of what healthcare might be. Now, based on your numbers, and I'm just going on what you told me, you fall well below the poverty line. So this is a program, the way it's drafted now, where you might have not to pay anything in terms of healthcare premiums. Take a look at the numbers overall. This is for individuals, first of all, making under $14,400 under the House bill. Again, just the House bill, you pay nothing. $21,660, you pay $1,083, and then as you can see the numbers so on, the last one, $43,320, paying a little over 10% of your income towards healthcare insurance. So that's sort of what the cost will be for individuals. Family of 4 is a good model. Take a look at those numbers as well. The lowest number, $29,106. Anything below that, you pay nothing. $77,175. Again, around 10%, and that's sort of where we're finding that the spot is in terms of the overall percentage of your income that would go towards healthcare premiums under this sort of government plan. Now, there are a couple things to keep in mind. There has been concern, will people flock from their private insurance to the public plan, to the sort of public option? And if you ask the president about this, he's talked about this several times, and he says if you have private insurance that you like, you get to keep it. The Congressional Budget Office, who we talked to about this, seems to support that for the vast number of people. If you have private insurance right now that you like, you're probably going to be able to keep that plan, and really your life won't change a heck of a lot. Another question that comes up a lot is the care going to be the same? Am I going to be able to get the same things under a public option that I get under my private insurance? And here's where it gets a little bit murkier. There's going to be a lot of what is known as comparative effectiveness. That's a term that'll make your eyes glaze over. But basically what it means is that this public option, a lot of these insurance plans, paying for what they know makes a difference, for what they know leads to a better outcome, for what they know actually improves people's lives. Do we do tests? Do we do procedures that we're not sure about in terms of those outcomes? Probably, and a lot of that's going to be tested, checked, and probably influence the way a lot of healthcare is delivered. It's worth pointing out that none of this is going to happen fast. 2011 at least before the tax increases to pay for some of this go into effect. 2013 before this healthcare plan insurance is mandated. Pre-existing conditions are taken off the table as something that can exempt you from healthcare insurance. So lots of steps still between now and then. And as the details become more clear to us, we'll certainly bring them to you. Back to you for now.